I'm Dr. Lisa Johnson, a family physician here at Providence St. Peter Family Medicine. Dr. Kruszyznik, I have known since she came here to apply for residency, and I remember sitting in my office with her and how impressed I was with her wit and her intelligence and her just complete understanding of what it meant to be a family physician even way back when.
I'm Dr. Kruszyznik and I work with Vantage Physicians. We started thinking about this type of practice, my former partner, Dr. Ogilvie, and I, probably about 7 years ago.
I'm Samantha Ritchie. I'm a family physician at Vantage Physicians. Well, Vantage Physicians uses a different paradigm for taking care of patients. Instead of having insurance be the way that we get paid, we actually have patients pay us directly. It's called direct patient care, and it allows us to give people in the community a different option for how to get their medical care, but it also gives us a chance to have less overhead and therefore be able to take care of fewer patients. Each patient then gets more of our time and energy.
Initially, we thought that we might be only seeing people who had money to burn. They might just have extra resources and decide that they wanted that high access to their physician. They wanted to have the luxury of extra time. And to our surprise, what we found was that this practice really appealed also to people who had no insurance at all.
There are lots and lots of people in the community who don't have insurance. Some people can afford $95 a month even though they don't have insurance. And they often come here and find a medical practice that really meets their needs. But Erin and I also try to help people who don't have insurance and don't have the ability to afford $95 a month. Patients can call us anytime they really need us or email us, and it allows busy patients to have contact with their doctor 24/7. What we found is that when they know they can get us, they don't call us that much.
We do have more time and energy left over at the end of the day to volunteer. And so both Dr. Ritchie and I are involved in local free clinics and volunteering in other capacities.
Dr. Kruszyznik has been very instrumental in establishing the Union Gospel Mission free clinic for chronic disease management.
So I am the medical director for the Olympia Union Gospel Mission's medical clinic.
So she's inspired a lot of us to come down and help out at the Union Gospel Mission, which has been very fulfilling for all of us, and I really have to credit Erin with a lot of the work to get that started. Dr. Ritchie has been a volunteer at Safe Place for many, many years, I know. She goes there frequently and takes care of the women's health care needs because oftentimes they don't have access to health care. While they're at Safe Place, she's kind of their medical guardian.
I'm involved with the Olympia Free Clinic, which is a new clinic that's just getting started up to help people in the community who don't have insurance access medical care. There's a huge need for that. I am grateful to Erin Kruszyznik. She started this business 4 or 5 years ago, and I got to join about 1.5 years ago, and it's been wonderful.